Hello, YouTube. This is Dr. Dennis Pabis with Otsuka Pharmaceutical Development and Commercialization. Recently, PsyQ hosted a webinar titled Pharmacokinetics, Plasma Concentrations, and Their Clinical Relevance. During this discussion, our speakers provided an overview of pharmacokinetics and pharmacodynamics. We discussed how these relate to formulations, including long-acting injections. And finally, we discussed how this applies clinically. As always, the presentation was sponsored by Otsuka Pharmaceutical Development and Commercialization Incorporated and Lundbeck LLC, committed supporters of the mental health treatment community. Speakers are paid consultants of OPDC, and I am an employee of OPDC. Let's look at a few clips from the webinar. So when we start off, we'll talk about pharmacokinetics versus pharmacodynamics. So what is pharmacokinetics? Really, it's the study of how the drug is processed by the body, and that encompasses absorption, distribution, metabolism, and elimination. And we'll go through those processes in a little bit. But it's basically what the body does to the drug once you take it. Pharmacodynamics is the study of therapeutic effects of the drug on the body. So it's the relationship of drug concentration and drug response, and how the drug action impacts therapeutic response and toxic effects. It's basically what the drug does to the body.
So let's take a little bit deeper look here, and we'll start at the upper left where the drug is administered and then absorbed into the systemic circulation. This is usually the blood plasma, but it really includes all of the other blood components. So when it goes into your blood, sometimes called the central compartment, the drug will exist as the unbound or free drug, the protein-bound drug, and depending on the chemistry of the drug, it'll bind to different proteins in your plasma. And then it'll also be there as its metabolized and modified forms competing with these other binding sites in your central compartment or blood plasma. So this is what circulates around and is then distributed at the top right into other tissues and organs. Now, this includes the site of action of the drug, but it includes a lot of other locations as well. One of these is where you can find the metabolism enzymes, primarily the liver, but they exist in other tissues as well. So what factors determine drug effect? Well, on the left, we have drug factors. On the right, we have patient factors. When we look at this, we can see that there are pharmacokinetic parameters. We've gone through those. There are pharmacodynamic parameters. Keep in mind, different people have different alleles in their body of different proteins. So some people will have more active enzymes. Some people will have more avidly binding receptors. We're going to be able to alter the amount of dosage and how we give it, the formulation. Is it an injection or an oral? Where are we giving this injection? Sometimes we can give the medication by intramuscular injection into the deltoid or the gluteus. Some medications are given in the vastus. There are a number of different places. All of them have different amounts of blood flow and the amount of drug that's picked up and how rapidly. Next, and finally, we can alter how often we give repeat doses of this drug.
So as Dr. Sacklad mentioned, we have the desired drug effect is related to the plasma concentration, staying within a therapeutic range for that patient. And that therapeutic range may be different for each individual based on what their genetics are, disease state, all those kinds of things that we went over. Now, some drugs do have a reference range of therapeutic concentrations, low versus high, but again, that's based on the population and where those levels fit. But if we're going to understand the PK of these drug formulations, so if we have slow absorption, for example, with an LAI, you have extended drug exposure, less frequent dosing is required. You have early metabolism, so there may be a lower bioavailability and a higher dose may be required. And if you have a drug with a short half-life, there's short drug exposure and you have maybe more frequent doses that are required. So if we understand these variables that affect PK, it can be important for us to understand how we may need to adjust treatment regimens. Thank you for watching our YouTube teaser. If you'd like to watch the entire presentation on psychu.org, please click the link in the description. You can take a look at our upcoming webinars while you're there as well. Be sure to follow us on Twitter, LinkedIn, Facebook, and Instagram, and have a great day.